Hi, my name is Christy. I'm going to be your nurse practitioner doing your head to toe examination today. Can you tell me your name and your birthday?
Troy Watkins on July 4th, 1994.
Awesome. Is there any issues that you want to tell me about today, Troy?
No,
Before we get started?
I don't think so.
Okay, sounds good. How's your health overall?
Pretty good.
Pretty decent. Okay, so we got your vital signs before we came in here. You weighed 165 pounds. You were 6 feet tall. Your heart rate was 70. Your respiratory rate was 16. Your O2 saturation was 100%. Your blood pressure was 120 over 68, which was normal, and your temperature was 98.2. Are you having any pain today?
No.
Okay, that's good. And if you were, you'd have to tell me, and then we would go through that. So we got your vital signs. Next, we're just going to do a basic assessment of your skin. So I'm going to look all over. It doesn't look like you have any lesions anywhere. You have some nevuses, which are just brown spots, moles, that kind of thing. You have a couple on your arm, some on your chest. You have a tan going on. Do you work outside?
Yeah.
Yeah. So I'm just going to look evenly. Everything looks good there. Looks to be in good hygiene, no lesions. Color is tan / pink. The texture, we look smooth. We have some hair on our arms and our legs and on our stomach. Our skin turgor is good. Skin elasticity is good. So next I'm going to look at your hair. So you have a good amount of hair on your head and some facial hair. It looks symmetrical, doesn't have any bald spots or anything. It's soft, brown, evenly distributed. Next, I'm going to look at your fingernails. So go ahead and hold your hands out like this, both of them. Your nails look good. They're soft. They're short. They do not feel like they have any grooves in them. The nail base looks good. Your cuticles look good. Your hands look good. No scratches, no lesions, nothing there. You don't have any clubbing. So your skull and your scalp look symmetrical, which I'm looking at. Everything looks good there. There isn't any lesions, no trauma looking. It looks like your head is normal sized for a person.
That's good.
Yes, it is. So just when normal occurrence, you don't have any tremors in your head. Everything looks fine there. So your face is also symmetrical within normal limits of shape. So we're just looking to make sure that you don't have any deformities. Sometimes that can mean cancerous and stuff like that. So we just want to make sure that that's normal. No unusual features, pigmentation, any ticks, anything like that. So next, I am going to look at your sinuses. So go ahead and face forward. So I'm just going to feel like right around your nose. Is there any tenderness or does it feel any pressure in through here?
No.
Cool. No pressure when I press?
No.
Okay. What about down in here? Any of that?
No.
Cool. Awesome. So, I just made sure that you didn't have any tenderness there. Nothing like that. So, I'm going to be looking at your neck. So go ahead and go like this for me. So your neck looks symmetrical. Go ahead and swallow. I'm feeling for your thyroid. Your thyroid doesn't feel enlarged. Go ahead and keep looking up. Go ahead and talk for me.
Talk about what?
Okay. Everything feels good there. There's no fullness. There's no masses. Go ahead and just turn your neck from side to side for me. Range of motion is within normal limits. No webbing, no extra skin folds, anything like that. I was looking at his trachea. There's no tugging. It's in normal position. The hyoid bone moves within normal limits for when he swallows. Thyroid is not enlarged at all. There's no nodules there, no enlargement, not tender, anything like that. So I'm also going to look at your scalp, make sure it's symmetrical, which it doesn't look like you have any like sort of lice or anything like that. No dandruff, and it feels fine whenever I palpate it, which basically touching it. I just want to make sure there's no extra skin, anything like that, okay? So everything looks perfectly within normal limits. Your fontanelles are good. Your hair distribution and texture is fine. We already went over that. Your sutures are fine. Next, I'm going to palpate all of your lymph nodes, okay?
Okay.
So go ahead and just raise your head up just a little bit. Yep, perfect. So I'm going to go in here first. Now I'm going to go over here, okay? I'm just feeling for lymph nodes. They don't feel enlarged from what I can tell so far. Okay, everything feels within normal limits. So next, I'm going to feel your jaw a little bit, okay? Go ahead and move your jaw around for me. I'm just feeling for what we call crepitus, which is a little bit of air leaking in there. Go up and down with your mouth. Yep, there you go. Everything feels within normal limits. Next, I'm just going to listen for what we call bruit. It just makes sure that there's no different sounds that we need to hear. His temporal artery sounds good. Go ahead and close your eyes for me. Everything's fine. And then go ahead and lift your head up. I'm just going to listen to your thyroid. Thyroid sounds good. There's no bruit anywhere in there. That's just an abnormal noise that would be indicative of something going wrong, okay? So, next, we're going to work on your vision. I have what is called a Snellen chart, okay? Have you done this at the doctor before?
I think so.
Perfect. So, I'm going to stand 6 feet away. Go ahead and read the smallest line down and close one of your eyes. Cover up one of them.
L, T, F, P, maybe an H.
Okay. And then can you keep it covered? Just wait until I tell you to take it down. Go ahead and look at do you see the 2 colors down here?
Yeah.
Tell me which one's on which side.
Green's on the right, red on the left.
Okay, now go ahead and uncover that eye, cover up your other one, and do the same thing.
L, T, F, P, H.
And the colors, and what side they're on.
Red's on the left and green on the right.
Okay, perfect. So you have 20/20 vision, which is awesome. Next, I'm going to do the confrontation test, which is and the 6 cardinal fields of gaze. So that way, I'm just looking at your eyes while I'm doing that, okay? So go ahead and look at me. Look at my finger. Can you see my finger?
Yeah.
Okay. Follow it. So you can follow my finger well. Awesome. Sounds good. So next, I'm just going to look at your entire face, around your eyes, things like that. So go ahead and look at my nose. Your eyebrows look symmetrical and even. You don't have any ptosis or anything in your eyelids. Your eye looks good. Your lacrimal glands don't look like they have anything in them, which is just where your tears come from. And your eye itself looks fine. So next, I'm going to look into your eyes. So basically what I was looking for there, just to make sure that your eyebrows are even, they're proportionate, nothing needs to be looked at there. There's no tremors, no redness, no swelling. I want to look at everything for color changes, condition, like your conjunctiva, your sclera, which is all stuff in your eye, any foreign bodies, anything like that. So, like I said, everything looks good. And next, I am going to turn off the light. Make sure that your eyes can accommodate to that. I know it's kind of dark now. So, go ahead, look at my nose. I'm going to look in your eye, okay? So, I'm just looking for a couple of different things. And you keep looking at my nose. Okay, I'm going to look really, really close, okay? Keep your eye open. I know it's really hard. Okay, next. Okay. So, what I was looking at there, I was making sure that your cornea looked clear. Okay, I was looking at all the blood vessels in your eyes, which they looked fine. They don't look anything. I was making sure that you don't have any pupil defects. Your pupils look fine. They're a little bit sensitive to light, which is fine. You have perfect perla. Everything looks good there. Your eyes did constrict, so that's also something that we're looking for. They have a light reflex. Your lenses look clear. Your red reflex is there. Your retinal color is fine. There's no lesions. Like I said, your blood vessels look good. Your disc looks fine. Your macula is good, and your anterior chamber looks fine, which is all just things in your eye that your eye doctor would also look at, but we have to look at just to make sure that your eyes are functioning well. So some of the things that could be wrong would be like detached retina, macular degeneration, that kind of stuff. So that's things that happen sometimes whenever you have eye problems.
Okay.
So we already did the extraocular muscles, so I asked you to cover, uncover, look at things, 6 fields of gaze. We did a light reflex on your eyes. So I believe that is it for your eyes. Next we're going to move on to your ears, okay? So I'm going to look in your ears and I'm going to look all around them. Okay. So I'm going to look in your ear, Troy.
Okay.
I'm looking at the outside of your ear. I just want to make sure there's no lesions, masses, any color changes, anything like that. So I want to make sure that there's no outside issues with your ear. Sorry. There's a little bit of earwax in there, which is fine. I'm just looking to make sure that your eardrum isn't ruptured or anything. It looks fine. The color's good. There's no other issues with your ear there. Now I gotta look in the other one. This ear also looks good on the outside, that there's no issues, no masses, lesions. There is also a little bit of earwax in this ear too. Your eardrum looks fine. Your ears are normal in appearance, shape and size, things like that. All the landmarks look fine. There's no swelling, no nodules appearance. Ears look good. Like I said, there is a little bit of earwax in there. There's no foreign bodies, anything like that. So your eardrum is also called your tympanic membrane. It's fine. The contour is good. It looks smooth. There's no water in there, anything like that. So next, I'm going to test your hearing. So go ahead and cover up one of your ears. Can you hear what I'm saying?
Yeah.
Okay. Let's go to the other ear. Do the same thing. Can you hear what I'm saying?
Yes.
Perfect. So that's called the whisper test. Next, I'm going to do the Weber and the Rhine. So with this, I'm going to use this tuning fork and tell me if you hear the noise that it makes, okay?
Yeah. Yeah. Yep. Yep. Yep.
Awesome. So you passed both the Weber and the Rhine. Everything looks perfect there, okay? So your hearing is good. Next, I'm going to look up in your nose and at your mouth, and that's the rest of your head basically. So I am going to use this again just because I want to look, and I need a little bit of light. I'm not putting it up in your nose, I promise. So I'm looking at your nose. It looks even right here. There's no mashes, no lesions. It's a little bit red, looks a little bit sunburnt. So I'm looking up in your nose. Everything looks good in there. Got a little bit of hair in there, that's fine. Go ahead and open your mouth for me. Okay. I'm gonna look in the back of your throat really good, okay? Okay, go ahead, open up. Okay. So I needed to make sure that you had a gag reflex. Sorry about that. But you have, your nose seems to be good. Your nasal mucosa is fine. Your septum's good. Go ahead and try to breathe out of one nose. Go ahead and breathe out of the other side. Your nose is patent. The cartilage looks good. The bone looks good. Your nose isn't tender, is it?
No.
Doesn't appear painful. Things like that. Your frontal and maxillary sinuses we already looked at when I felt them. They're not tender, nothing there. Your mouth, your lips are pink, symmetrical, no edema, no cracks, no chips. Your teeth look good. There's no occlusions, no dental caries. There's no missing, no loose teeth. Your gums look fine. They're pink. They're moist. There's no lesions. Are they tender?
No.
Okay. Your tongue looks good. It's symmetrical. There's no swelling, no ulcers. Your uvula looks good. And your palate's fine. So you do have a gag reflex. Did you have your tonsils removed?
Yeah.
Okay, perfect. So next, we're going to move to the chest and lung portion, okay? So I'm going to look and palpate your chest, which means touching. Go ahead and cross your arms. Okay, so what I'm looking at is your trachea, so go ahead and lift your head up a little bit. Trachea is good, we already looked at that. I'm going to look at your sternum, which is midline, it's fine. Everything looks good there. Your clavicles look good as well. So, your shape and size and symmetry, your AP lateral diameter looks fine, looks proportionate. There's no, go ahead and uncross your arms. You don't have any rib prominence, anything like that. It's symmetrical within normal limits for his size. So he looks like he's breathing easy. There's no issues there. He doesn't have any retractions, anything like that. So I'm going to listen first at all the quadrants of your lungs, okay, just to make sure that everything looks fine. So give me a big deep breath. Okay, and another one. Okay, go ahead and lean up for me. Okay, take another big deep breath. Okay, big deep breath. Okay, everything sounds good. I don't see any or hear anything abnormal like any stridor, crackles, rails, pleural friction rub, anything like that, no wheezes. He has good thoracic expansion. So I'm just gonna listen again. Go ahead and say 99 for me.
99.
Say it again.
99.
And again.
99.
Okay, and again.
99.
Again.
99.
Again.
99.
Okay. So I'm just gonna feel your chest now. I don't feel any crepitus or anything like that. Next, I'm gonna measure your chest.
You do that.
Go ahead and lean up.
I think tape measures up there.
Yeah, that's pretty cool. Okay. Go ahead and take a big deep breath for me. It's about an inch, which is good. It's within normal limits. Well, I'm gonna break the tape measure. Oops. That looks great. So that's your diaphragmatic excursion. That's fine. I didn't hear any unexpected breath sounds. Your vocal resonance is good. So next, I am going to have you stand up for me. I'm just looking to see if there's any areas that have any issues. So that is inspecting your pericardium, sorry. And go ahead and sit back down, you're good. So I'm looking at your apex, your sternum borders, your sternum for pulsations, heaves, or lifts. You don't have any. This is your heart assessment, okay? So I'm just going to palpate. Just where your heart would beat. Those are your two apical heart places. I didn't feel anything crazy, like a thrill or anything like that. So I'm just gonna feel the rest of your chest here real quick. Everything feels within normal limits. So I'm just gonna listen to all the different areas of your heart, okay? I only hear S1 and S2, which is just the love dub that you hear. I don't hear any extra heartbeats, so that's good. Okay, so there are 5 places in your heart that we just checked for, okay? Your aortic, pulmonic, your tricuspid, mitral, those are all your valves, and then Erb's point. So they all sound normal. Nothing sounds bad. There's no splitting, no extra heartbeats, okay? But if there were, I would look for a murmur. I would document the timing, duration, pitch, intensity, pattern, quality, the location, the radiation, and any variations in it. I don't hear anything. I am going to listen with the bell of my stethoscope just to make sure, and murmurs can, that's just like an extra heartbeat or things like that. That's not typically a murmur. A murmur is like a whoosh sound in your heart. But we just want to make sure that it's not actually there. Yeah, I don't hear any murmurs. Awesome. So I want you to go ahead and lay down for me because I am going to palpate your precordium, and you gotta be laying down. So okay, and go ahead and stay there for just a second. So I'm gonna look at your abdomen now. So I'm gonna inspect your abdomen. You are supine. Go ahead and put your arms to your sides. Abdomen looks good. It's symmetrical. Go ahead and just kind of raise your head just a little bit. Like, just raise your head up. Like, there you go. And I'm just looking at your belly muscles. And go ahead and put it back down. Making sure that there's no lumps, bumps, bruises, no hernias, no masses, nothing like that. Everything looks fine within there. Your skin characteristics, you have fine symmetry. Your surface motion is good. Everything looks good. There's no separations, nothing like that. So I'm gonna listen to your bowel sounds next, okay? Okay, everything was within normal limits. I am going to press all of your quadrants and listen again for any bruise. So give me just a second. I'm just gonna listen again. Okay, I don't feel any bruise or hear any bruise. So everything feels good there. I'm gonna do some light palpation. I don't feel any masses or anything. Now some deep palpation, I'm sorry. Does that hurt? Sometimes it's a little bit ticklish.
I don't feel great.
Okay. Next, I'm gonna look for your liver. Don't tense your stomach muscles up, please. Your liver feels good. Orders are good. Feels within normal limits. Go ahead and kind of roll on your side here. Just a little bit, like, there you go. I'm just feeling for your spleen. Did that hurt? Or is it just a little bit ticklish? Okay, I'm sorry. That's how we just feel for your spleen. I don't feel your spleen. Your liver is nice within normal limits, okay? So I did the percussion of your abdomen and all quadrants. The tone of your belly looks fine. Your liver span is within normal limits. You don't have any gastric air bubbles in there. I did light palpitation. I didn't feel any tenderness masses. Deep palpitation was fine. Your belly button looks good. There's no bulges, no masses. You don't have a gallbladder because you had it removed. Your spleen is fine. So next, what I'm looking for, there's no aortic pulsations. So go ahead and put your feet all the way down. No, I mean like lay down like this and put your feet all the way down. What are you doing?
Yeah.
No, just lay like you were and put your feet all the way stretched out. Okay. I am looking for any aortic pulsations from this point as well. I don't see any. There's no other masses that I can see. So go ahead and sit up for me. I'm gonna feel your kidneys next. I'm just feeling his back, just where his kidneys would be. And then, does that hurt?
No.
I'm percussing. And a little bit of deep palpitation, nothing there. Everything feels within normal limits. So, next, I am going to just have you sit there. I'm going to feel your pulses, okay? This is your radial pulse. It's within normal limits. Sometimes you can feel one up in here too. Yep. Let me see the other side. Okay, so just go ahead and relax for me. Go ahead and just scoot a little bit further so I can feel the back of your knee. Okay, everything is within normal limits. So you have some pulses in the back of your knee, your feet, your ankle, on your arms. Everything feels within normal limits. The rate's good, the rhythm's good. The altitude, it's a 2+, which is a good. I'm going to, actually, I already listened to everything besides your carotid artery, which is up here in your neck, okay? I just want to make sure that everything sounds good. I already listened to the rest of your arteries, which is what I did when I listened to your abdomen. Okay. Carotid artery sounds good. I know this kind of sounds foreign to you, so I'm trying to explain a little bit as I go. I just want to make sure that all your arteries are good so that your blood's flowing fine, okay? So as I was looking, I'm gonna look for any JVD, jugular vein distension, any pulse waves, any pressure. I looked at the peripheral veins and arteries for insufficiency. Whenever I was also checking the pulses, I was looking at his arms. His arms are they have color to them. They are smooth. His nail beds are fine. There's no nail changes. Any missing patches of hair, they look fine. No muscular atrophy on either his arms or his legs. The texture is good. He doesn't have any edema, no varicosities. I also was palpating his extremities whenever I was doing his pulses. Everything feels good. He's nice and warm. Like I said, everything has good color, quality. There's no tenderness, no pitting edema in his feet. Everything is warm. His feet are warm. His ankles, his leg is warm. There's no hair loss there. So